Okay, let's begin with prayer. Dear God, we thank you for the rest you've given us. Thank you for the Sabbath. Thank you for another opportunity to study. May you be present with us to give us understanding and the right perspectives. In Christ's name we pray. Amen. Okay, so we're just going to continue with our study and hopefully we can finish it. There's going to be a bit of reading this afternoon. Because there's so much to share and I don't want to leave anything out. So I'm going to try my best to make sure that we get through everything. It also gives us, the study gives us a good perspective of South African politics.
Recording in progress.
Just a second.
Take a note.
Why do you switch it on? Don't switch it on. Why do you?
Never danger voice.
Recording in progress.
You go kanji cheko.
Wait. Let's not put the sound on.
Recording in progress.
Don't put it on. Sorry about that. Trying to figure out sort out some technical things. Okay, so we're gonna continue with the history and then we'll try to discuss later. We're going to go to the history of 1990. Okay, let's recap from 1990. Just so we can retrace our steps. So between 1990 and 1993, the ANC's policy proposals are constrained by political and ideological pressure. So we've seen that the ANC is split between radical socialism. In other words, when ANC is going to take over the new government, which policy is it going to follow? Is it going to follow radical socialism, in which there's a redistribution and that the primary driving force is to bring about equality and cover up the gaps that were created by the apartheid government? Or is it going to emphasize on economic development? Because some voices in the ANC, the radical socialist voices are like saying, no, we need to redress the injustices of the past, the inequalities of the past. And then you have more liberal voices saying, no, if we grow the economy, then we will be able to provide even for the poor. So there was that tension going on within the ANC itself. Within the party, you've got those two think tanks, and there's this dichotomous economic and political position, which of course impacted on the health systems reform policies. The debate was reflected in the sectors of health. So the radical socialists were for the development of a national health insurance, which would cover everyone, whereas the economic conservatives were for allow the private sector to thrive and do whatever it wants, and then work on the other side to grow up the public sector. And this is the stance that the ANC took over the past 30 years, the stance of compromise in terms of the fact that the ANC kind of gave into the powers, the economic big powers from the global world, from the World Bank, and other organizations who came and sponsored ANC members to go to New York and work in the big banks and learn how capitalism works. So eventually ANC ended up compromising on the side of economic development. However, the more socialist voices continued to fight for the introduction of a national health insurance. Okay, so that's going to bring us to the history of 1994 to 1998. Because 1994 is when we have the first government of national unity after apartheid has ended. And it was decided that any party, that all parties during that election, all parties that got a 10% vote at least, would all constitute the new government of national unity. So in that election, the ANC won 63% of the vote and 2/3 of the seats in parliament. Of course, Mandela was appointed as the first president. And then even though the ANC had a freedom charter, which we've already looked at, which was going to be promoting the implementation of a national health service that was that would provide healthcare for all. And also, and although we've seen that that was also covered by the Constitution, however, the ANC, we've seen that there were two contesting voices, two independent policies that were at tension. We see that that when this government of national unity was established, it faced a lot of challenges. Besides the tension within the party itself, the ANC party itself, there were difficulties that were inherited by this first government of national unity. First of all, the civil service was bloated, inefficient, and corrupt. The civil service, was bloated in the sense that they had employees that were not necessary. But the previous government, their government of apartheid, had created a comfortable life for white citizens by providing them jobs, creating jobs, and making sure that everyone is provided for. Those that didn't have jobs were given houses, they had cover from the government. So when the ANC takes over and the government of national unity at that time in 1994, the civil service was completely inefficient. It was very corrupt. The second challenge was that during this transition period, many government posts were taken over by ANC members who were inexperienced in governing, and they were given powerful positions, appointed to many government posts, and yet they were not experienced enough to run those posts. And some of those posts were very, very powerful, where big monies were being handled. So this led to some inefficiencies and misuse of resources. The third challenge was that the ANC inherited a failing economy. Already the gross national product was only growing at a national average of 8%. Many people are under the perception that when the ANC took over, that's when the economy started failing, but that's not true. Already by the time the ANC takes over the government of apartheid, the economy was already failing, because we've seen that you couldn't have a government where the vast majority of the population are working and paying taxes and not benefiting from the system, but that the system is designed to deliberately provide for those, for a certain portion of the population. So they created unnecessary jobs. They provided for everyone. If you see the RDP houses of during apartheid, those are the houses that now in the new era, were being bought quite expensively by anyone that could afford them. They were really good houses. If you compared those they didn't call them RDP houses at the time, but it's the houses that were built for whites that did not have means. And they were really good houses. And so you had a government from 1948 that was taking all the measures necessary to protect white citizens. And so by the time the ANC takes over, the economy was already failing. So we need to get that correct. So in addition, the health system, So it is in this context that now the ANC is going to have to implement the national health insurance. And then, of course, within the ANC themselves, they are still debating this matter. They are still not sure which direction to take. So, so while the government is the way that it is in the health sector, 76% of expenditure in the public sector was spent in hospitals. So the health system was more hospital-centered, curative-centered, rather than primary care, primary and preventative healthcare system. And we already saw that a preventative hospital-based health system is far more expensive to run than a primary preventative health system. So you have a government spending so much on healthcare, but is not effective. And it is not even appropriate because it's not meeting the needs of the vast majority of the people, even just within the public sector. But anyway, regardless of all these challenges, the ANC was committed to try and drastically improve the health and welfare services. So when Mandela was first president, the first thing that he did was to announce the free care policy. The free care policy was going to make healthcare accessible for all pregnant women and children under the age of 6. So while this was going on in the public sector, in the private sector, remember that regulation we spoke about during the years of apartheid, where the government decided to control the private sector so that the beneficiaries of the system are protected. Remember the example by how I gave, if a system is not regulated, prices can go up without any control. Governments need to sometimes regulate these things and put caps and controls on the system so that the system doesn't go wild, so that people don't just charge whatever they want. Government during apartheid years, they regulated the private sector so well so that 80% of all white people were covered by medical aid during apartheid years. But now when the Black government takes over, or the government of national unity takes over, you will see that there is this mindset of government stepping out or stepping down on the regulations. And so the private sector costs started to skyrocket. And accessibility started to become a problem. Medical aids became so expensive. So the government was not, the new government was not doing what the old government was doing to protect its white citizens. Instead, they were trying to implement the NHI, even though they had all these challenges that they inherited. So what then happened, instead of doing what the old government had done in regulating the private sector, because they did not do that well, costs in the private sector started to go up. And then by the 1990s, there was only like almost three hospital groups that owned almost 45% of all the private sector beds. And some doctors had vested interests in for-profit hospitals, resulting in unnecessary hospitalizations and further driving up costs. So we all know this is how private sector works. A pregnant woman, you go to a private doctor. They monitor you through your pregnancy. Then when it's time to deliver, you go to a hospital. You don't go to a clinic because hospitals are more expensive than clinics. In a clinic setting, you can be attended to by a midwife. Midwives will not charge as much as specialist gynaes. But in the private sector, we know everyone, if there's any one of you here that has medical aid, if you fall pregnant and it's time to give birth, you go to you are attended to by a gynecologist. Whether your pregnancy is high risk or low risk, it doesn't matter. You're attended to by a gynecologist, a specialist. Their fees are high. And then when it's time to deliver, you go to a hospital. Yes, depending on how they analyze your psychology, they may recommend a Caesar immediately, or they may wait on you. And if things don't go, as soon as the slightest indication, they're driving their clients to cesarean section. So we know in the private sector, they do cesarean sections are at a rate of over 50% right now in South Africa. Half of the women in the private sector deliver by cesarean section. And the cesarean section right now on average is around 60,000 rand, whereas a normal birth, a normal vaginal delivery may cost in the private sector maybe 12,000. So the difference is very vast. And in the public sector, no charges, you see. So the private sector, when it's not regulated, it drives up costs and it leads to unnecessary hospitalizations, unnecessary interventions, unnecessary treatments, because it's all profit driven. So clinicians are more likely to do procedures just because they make more money out of it, but not because it will benefit the client. So then, and also because it was not regulated, the medical schemes were really running rampant, doing whatever they want. They didn't want to enroll members over the age of 55 because they know after 55, most people will have some chronic disease and then they will have to spend more money. They were refusing to cover HIV positive people. And so that was the status of the public sector, or the private sector, so sorry. So immediately after the election in 1994, the ANC then released a discussion document, which they entitled A National Health Plan for South Africa, outlining the plans for health sector reform. So the document stated that a single, comprehensive, equitable, and integrated NHS would be created and legislated for. But, it says it was all carefully worded because they did not want to offend the people that were in the private sector. Allow me to quickly go through the history and then we can discuss. But if anyone has a question or a comment at any point, interrupt me, please. So the Minister of Health at the time, 1994, was Nkosazana Zuma Dlamini. She was a medical doctor, and she was fairly radical on the issue of radical socialism. She was really committed to the establishment of a national health insurance. And so in 1994, a healthcare finance committee was established to examine the feasibility of the NHI system, and then to propose various models of how it was going to work. So this was Minister Zuma and her agenda. But of course, there was a lot of opposition to this. And this committee was set up, and there was a guy by the name of Dr. John Dibble from Australia who was going to provide his expertise in helping to establish this health insurance, national health insurance. And when they presented their proposal, there was a media outcry. People called Minister Zuma a socialist. They said that her plan was a threat. It was sinister, and that she was gagging people and preventing them from expressing their opinion because she was trying to push through this NHI without considering other voices. So this is how people that had a voice because generally I feel it was the people in big business in the private sector that called Zuma names because of what she was trying to do, trying to push forward the agenda of the NHI. And so because of all this opposition, another committee was established, the Committee of Inquiry into NHI, which was chaired by Minister's Aide, the Minister's Aide, Olive Shisana. Some of these names are familiar, and some of you might remember some of the histories that are related to this. So anyway, this committee of inquiry was also called the technical committee to take these recommendations, some of the recommendations that they came up with. And many of these recommendations were opposed by the Treasury. And you will see that all through this history from 1994 to 2024, the argument has always been that the NHI is going to be too expensive. The government can't afford it because it will require for taxes to go up, and people don't want their taxes to go up, right? You know, Republican-minded people, right-wing-minded people are into small government. They're into reducing taxes. They don't care about the well-being of other people. So anyway, there was an SHI. SHI stands for Social Health Insurance working group that was established. It was a small, low-profile group of about 6 analysts and Department of Health officials who are tasked with developing a detailed proposal for a social health insurance for the public hospitals. So this working group was also asked by Minister Zuma to consider the ideas that were presented by this Dr. John Debo. As I said, I will share this document so that those who want can read it for themselves thoroughly. I'm jumping through everything. Minister Zuma and her ideas led to some backlash from the World Bank and other conservative bureaucrats, some of whom were apartheid-era civil servants. They were not interested in the reconstruction development plan that was implemented when the government on national unity was launched. So in 1996, the leftist influenced reconstruction development plan was replaced by GEAR, a purely neoliberal macroeconomic policy influenced by the IMF and the World Bank. The IMF and World Bank emphasize free market capitalism, fiscal conservatism, privatization, tax reduction. I hope this sounds familiar. This all sounds like Republican Party ideology. These are forces that are fighting against Minister Dlamini Zuma, who wants to establish the NHI. So there was stagnating finances in combination with the explosion of HIV/AIDS. So we're going to look at Minister Zuma on the one side. She's trying to do her thing, but there are so many forces against what she's trying to do. And some of those forces, of course, we've identified the World Bank and the IMF. So these are external forces. But then there are other forces internally. It is around the time that HIV was exploding on the scene. And HIV, we're going to see that this HIV pandemic became a factor that overshadowed now the plans of the NHI. It became a distraction, really, because now focus was on the HIV, which became a huge debate, as we are going to see. And then, so while the pandemic was going on and the government was involved in controversies around the HIV and how to address it, attention was diverted from the NHI policy. Okay, so stagnating finances in combination with the explosion of HIV/AIDS and a series of related political scandals So political scandals were also another issue, challenge that the NHI agenda was facing. So the NHI agenda in the past 30 years has faced challenges from the perspective of the HIV/AIDS pandemic, and external forces like IMF and World Bank, and also the corruption and mismanagement of resources by the governments itself. So in 1995, when HIV became recognized as a pandemic, by that time, about 4.3% of women going to maternity, antenatal clinic visits were HIV positive. And it was a time when the virus was spreading quite rapidly. People were dying en masse and getting really, really sick. Hospitals were filled up with AIDS-related conditions. In this history, in 97, there was a drug that was developed by some local researchers, Ziggy and Olga Pfizer. This drug was called Virodin. So they tried to introduce this drug onto the market, trying to get the president, the presidents and the minister of health to endorse this drug. However, the Medicines Control Council, so we do have in South Africa what they call the Medicines Control Council. This is the organization that is responsible for making sure that all the drugs that are in the market in South Africa have been tested, they are safe, they have gone through all the scientific trials, and they can be safely used on the public. So when they looked at this drug Virodin, the MCC refused to give permission for that drug to be used because they said that the drug had not gone through the processes of testing it and trying it on biological tissues or on animal experimentations. Its benefit for AIDS sufferers was not guaranteed. It had not been studied. So it became a scandal in the government, involving the minister, involving the president and all of that. So this issue distracted attention from the NHI for a while. Then now we come to the 1999 to 2006 history. In this history, AIDS is becoming very, very prominent. And just, if some of you who are old enough can remember the history, there was a lot of controversy about HIV/AIDS. Remember, it was in the time of, we're going to look at the history of President Mbeki and Minister Mantu Chabalala, and the whole thing about the African potato, ARVs, all of that. So in 1990 to 2006, the HIV had become such a health crisis, that and the challenge was that, does anyone remember what the challenge would have been in this time period concerning the pandemic itself? Does anyone remember the position that Mbeki took on this problem? Because by 1999, remember in 1990, someone talking? Hello? Was someone saying something?
I remember something about a man who, yes, it's Kanya.
Yes, go
You
ahead,
hear me?
Kwanya.
Yes, I was elder school. Hello? I was saying, I remember something about Manto Shabaralam Simang saying something about people should just eat beetroots, if I'm not mistaken.
Yes, you're correct.
Were you able to
So
get that?
remember, Yes, absolutely right. So the time when Mantu Chabalala was recommending people must eat beetroot, white African potato, that HIV/AIDS is not really real. It's created by poverty. It's not created by a virus, and you know, there was all this. In fact, let me just read. In 1999 to 2006 period, the fight to compel the state to roll out a HIV treatment program garnered far more policymakers and civil society attention than the health system reform agenda. So now the whole thing about NHI is put aside because now we are trying to debate about the HIV treatment programs and all of that. By this time, 20% of pregnant women are HIV positive. It's a jump from 4.3 in 1995. So it's a significant jump. HIV is spreading like wildfire in South Africa. By this time, South Africa has the highest number of HIV positive people in the whole world. And 20% of women who come to the antenatal clinics are positive. This is 1 out of 5. It was huge. Nearly half of the armed forces are HIV positive, and AIDS was the leading cause of death in the country. So by this time, all attentions, whether political, social, are on HIV/AIDS. And in this era, in this debate, the FISAs are trying to introduce this drug, which is not really being tested. And Becky, on the other side, is listening to the conspiracy theories that are coming from the United States that AIDS is not a virus, not caused by a virus. AIDS is an agenda by the who are these people, by underground people to destroy Africans and reduce our numbers. So there's this AIDS denialist rhetoric from the US, and Mbeki is actually drawn into it. And together with the minister, they are promoting beetroot and they're promoting beetroot and white potato. So they don't want to invest in developing drugs for HIV. I remember these arguments. I was young. I was a young doctor then, and I was actually dragged into those debates because there was also, I remember the controversy became so heated. I don't know if people remember the treatment action plan. So there were two voices in the country. There were voices that were advocating for government should invest in HIV research and the development of drugs to prevent the deaths that are happening. But on the other side, you have the president and the minister saying, no, AIDS is not caused by HIV, AIDS is not caused by HIV. People just need to be healthy. The problem is poverty that needs to be addressed. And so Mbeki, along with the Minister of Health, Mantu Chabalala, they are questioning the connection between HIV/AIDS, the accuracy of AIDS tests. You know, they're even questioning that. They're saying, are the tests really accurate? Are all these numbers that we have really accurate? And are the drugs safe? They were arguing that AIDS was a Western conspiracy based on racist stereotypes of African sexuality. There was actually an argument going on that the West is creating this whole conspiracy about AIDS because the African sexuality is under question. Anyway, during that time, there was a civil society action group that was created called the Treatment Action Campaign that would offer a counter argument to neoliberal forms of governance in 2 areas. The limits of the state's responsibility to provide healthcare and the obligation of the state to regulate markets for the public good. So TSC took the government to court. They were really campaigning for the government to provide drugs to prevent mother-to-child transmission. I don't know how many of you today in 2024, 23 have ever seen an AIDS baby. In the 1990s and early 2000s, those babies were so everywhere. Hospitals were full of babies who were HIV positive from the mothers. And it became a pandemic and a crisis and a disaster. So that people started campaigning and saying government is responsible for its people. And government must develop drugs to give to mothers so that the children don't get HIV. And TSC is the one that was working at the forefront of this. The government was sluggish, they don't believe in HIV, and they think the drugs are too expensive. For example, there was a drug called azithromycin, which was going to cost the government $240 for each person that used it every month. Imagine, it was too expensive. And those were the arguments those days. And I think, that equates to about 4,300 Rand in rands. So imagine all the people, all the women that come to antenatal clinics and they are positive and they need this drug every month. The government was going to have to spend this 4,300 Rand every month in today's currency. But generics were becoming available. So all these action groups are going to be advocating for the government to take a stand, to take a position and make a decision to protect children, whether they're going to spend that money or use generics. Generics were far cheaper. Rather than paying $240, it was going to cost $50 per month. So these are the issues that now face the Minister of Health, and the issue of national health insurance was on the side. The TSC, TAC, was arguing that health is a constitutionally enshrined human right, that the state has a legal duty to protect, that excessive pricing of essential medicines by pharmaceutical companies violated these rights. Now, you see here, what we need to see is the connection between pharmaceutical companies and government. Government has kind of taken the compromising position of let's make money, let's build the economy so that we can help the poor, apparently. But in this, they're allowing the private sector to thrive. Drugs are created are made and developed by the pharmaceutical industries, which are multinational, very global based. And these are the companies that want to make money. They capitalize on human sickness and disease to make money. So they are in it for the money. And now there's a new disease on the scene, HIV/AIDS. It's an opportunity for private sector to make big bucks. And it's a crisis facing humanity, governments, health ministries all over the world. So everyone is trying to find a way of making money through this thing, through this HIV pandemic. So pharmaceutical industries are developing drugs with the pure intention of making money. They're going to develop these drugs and overcharge people because it's a new disease, it's scary, everyone is looking for a solution. People who can afford it are ready to pay whatever it takes to make money. So you will see this interaction between the government, pharmaceutical industries, and then all there is for the public is organizations such as TAC arguing for trying to present their argument on behalf of the general public. And yet we are faced with a president and a minister of health who don't even really believe that HIV is a problem. And so you can see how this system is now going to really set back the development of an NHI. While they are scrabbling about HIV and arguing on issues pertaining to money. So then in 2000, there was a trial that was conducted on the drug called nevirapine. Nevirapine, we still use it till today. By the way, I asked the question, have you ever seen a baby now who is sick with AIDS? Like you hardly see it. Thanks to the drug nevirapine. Nevirapine is the drug that we give to mothers. Okay, now we no longer give it to mothers. Mothers are just given the ARVs, the normal ARVs. If a mother is positive, she's given ARVs during pregnancy. If a virus is undetectable, the baby will not get HIV. The baby will born disease-free. But once the baby is born, and a mother is found that she was not taking her ARVs properly, or the viral load is high, or she didn't know her status for some reason, which is very unlikely in this day and age, then the baby gets given nevirapine and AZT, those two drugs for the first month. Once a baby gets nevirapine for the first month, that baby is not going to get HIV, even though the mother will be breastfeeding. It's one of the most powerful developments of modern medicine that we can talk about now. Because prior to that, if a mother is pregnant and she's positive, the baby will be born positive. And I remember that in those days, there was a Dr. Rath who came to South Africa from Germany. He's a German scientist who was arguing against ARVs. He was saying that if you feed people good food, if you give them multivitamins, they can be cured of HIV. This guy came to South Africa and established a business in Cape Town. I even ended up working for him myself with another friend of mine. We were working for his organization. And we were the people that were completely opposed to ARVs. And we were working with Dr. Rath, and we were trying to treat HIV with vitamins. And it's all coming from that conservative perspective that drugs are dangerous, they kill people, they do more harm than good. And we were encouraging people to stay away from ARVs and concentrate on building their immune system using multivitamins and using diet. And I can tell you now that there was that huge battle that went to court between Dr. Rath and TSC. And TSC ended up winning that court case. By the way, they even took the Minister of Health to court for failing to provide nevirapine to mothers and babies to prevent the transmission of the virus. And that was a very dark time because we didn't have information. I didn't have understanding myself, and I got myself involved in this whole Dr. Rath issue. Many people died who could have survived maybe. I know that in that period also the ARVs were not perfectly developed. Many people were on drugs. The drugs had terrible side effects, and some people would end up leaving the drugs because of the side effects, and then they would end up succumbing to the virus. But as the government began to recognize the validity of the HIV and AIDS disease and begin to invest money and resources, and we got a lot of help from the US government. They are still even present here in South Africa helping to fight HIV/AIDS. The drugs have become really, really sophisticated and very, very effective. Today, we are talking a one tablet, which is called TLD, which is so effective. It has very minimal side effects. And it works really, really well for patients to the point that now, if a person is on ARVs, on TLD, you can't even know that they are positive. And babies, we hardly see babies becoming born HIV. So science has done a great, great deal in addressing HIV. And in South Africa, I think the battle against that pandemic is well under control right now. In fact, now post-COVID, we are not so much worried about HIV as we are worried about diabetes and high blood pressure. High blood pressure and diabetes have now become the biggest problem, causing lots of disability and death. Anyway, let's continue with the history. That was just a side note. So the health system reform process stalled somewhat during the AIDS denialism era. And while the AIDS crisis distracted public and policymaker attention from the health system reform agenda, it occurred alongside and arguably exacerbated growing health challenges caused by the public-private divide. So it's in this history that the white paper also spoke of contractual arrangements and tariff negotiations to facilitate the utilization of private sector beds by public sector patients and introduced the idea of the certificate of need. So what is a certificate of need? If a private doctor wants to open a practice anywhere, they had to apply first. There was the need to control the private sector so that GPs don't just open practice anywhere, anyhow they want. They needed to get a certificate of need. The doctor needs to prove that in this area, there is no services, patients are not getting help. I need to establish a surgery here. And so that idea of a certificate of need was presented in 1999. And I want to inform you that just this month, the certificate of need has been withdrawn by the High Court. This is not necessarily a positive thing. It's something to do with the private sector. The government for the past, from 1999 to this year, was able to put some control on the private sector through this certificate of need. But now it has been withdrawn, especially now that the NHI was signed into law in May. Now in July, the certificate of need is withdrawn, which means doctors can open practice anywhere and charge any amount they want to the public. So costs in the private sector continue to rise to a combination of overutilization, overservicing, and high administration fees. And medical scheme membership contributions were increasingly unaffordable, even for relatively well-off South Africans, because the cost was going up so much. I mean, on average now, for a family of 4, 2 adults and 2 children, a good medical aid will cost you nothing less than 6,000 a month. It's too expensive. Like for some people, that's a big percentage of their salaries. Even people who work and earn can't even afford these medical aids in the first place because of spiraling costs. So then we get to the 2007 to 2015 history. This is the history in which Zuma becomes president. The history of Zuma is very interesting. In this context, an increasingly unaffordable and unsustainable private practice and growing doubt and impatience about the ability of neoliberal macroeconomic strategies to fulfill the promises of the new South Africa. It's in this context that Zuma becomes president. Okay, so in 1994, the ANC compromises on radical socialism. It rather opts to go for economic development. Those voices are winning. Then it goes into a coalition with other parties in 1994. And then in that history, because the ANC is divided, it can't really have impact its freedom charter on the plan, whether they should have an NHI, right? So then, as it's trying to debate what to do and how to do this NHI thing, being not fully committed, AIDS become an issue. Then the AIDS become a crisis, and then the attention is diverted from AIDS, from NHI to AIDS. And then while that is going on, now we come to the history of 2007, when this decision that ANC took to implement economic growth is now under question. People are doubting, is this thing really going to bring about equality? Is making more money going to bridge the gap between the rich and the poor? And the private sector is growing and becoming more and more expensive. Less and less people can afford it. So it's in this context that Zuma is going to become a president. And what kind of president is Zuma going to be? Zuma is going to succeed Mbeki. He's going to come after Mbeki. Now, during Mbeki's reign, Mbeki is not only denying the existence of HIV/AIDS, but also Mbeki is a neoliberal. He is on the side of big business, privatization. He is into, let's build the economy. Then the economy will take care of the poor. On the other side, you have Zuma now, who was vice president to Mbeki, but he's now going to become president. Zuma is an authoritarian. He is a nationalist. He's anti-intellectual. He's militant, cultural, and patriarchal. And he's pro-poor. So, these are members of the same party, but completely different mindset. While Zuma is pro-poor people, and he is now going to be the one that is going to try and push the NHI project. However, he is very much patriarchal and authoritarian. And we are going to see that even in his presidency, the NHI does not go anywhere. Really, it made some advances, but there were issues. Okay, so in 2007, at the ANC annual conference in Polokwane, Zuma was elected president of ANC. The urgent implementation of the NHI was adopted as official ANC policy, and an ANC NHI task team was appointed to further develop the policy. So good, things are looking up. Zuma, who's pro-poor, is now president. And the ANC is going to adopt the NHI task team. So they are making a commitment and saying, okay, we're going to push this thing through. But in 2008, there was a global crisis. And the global crisis is going to affect the neoliberal people, And so the 2008 global crisis loosens the neoliberal hold on policy. There is a minister, Blade Nzimande, Minister of Education, Higher Education. He's warning that any policy proposal that challenges the neoliberal agenda and elite class interests would be met with resistance. In addition, President Obama is now the leader of the United States, and he is promoting what? Obamacare. He's trying to drive for healthcare reform in the US. And this is now widely reported in South Africa, because South Africa is also in the same debate. It's trying to implement the NHI. So whatever Obama is doing in the US is going to be reported here it's going to have an impact on South Africa. The other impact is that the World Health Organization at that time starts to talk about universal health care in 2010. And they are presenting it as a package that should include the private sector. They are presenting it as a principle, saying to governments all over the world who are members of the WHO that if you want to implement universal health care, the government should work hand in hand with the private sector. So these are the forces. I'm naming the forces that are going to now be at play when in Zuma's presidency, they are going to also be trying to push forward the NHI agenda. So in 2009, the ANC election manifesto promised the introduction of an NHI that would be publicly funded, publicly administered, free at the point of service, and would engage with private hospitals and group practices to encourage them to participate in the NHI. Then Zuma appoints Aaron Motsoaledi as the new Minister of Health. Motsoaledi was very much like Zuma. He's also Zuma, and I mean Dlamini Zuma, not Zuma president. Remember, Dlamini Zuma was the Minister of Health under Mbeki and Mandela, and she was pro NHI. But when Mantu Chabalala comes in as Minister of Health under Mbeki, she is not really pro NHI, and she of course gets distracted by the HIV/AIDS pandemic. But now we're coming to the time of Zuma being president, and Aaron Motsoaledi is now the Minister of Health. Aaron Motsoaledi was very much passionate about advocating for the NHI. And he tried to push through the NHI agenda. By 2007, the number of, now looking at some statistics, the number of private hospital beds per medical scheme beneficiary was twice that available to those depending on the public sector. So there was, like, for example, what this means is if I am a patient in the private and then I go to a private hospital, I can have access to 2 beds, literally. I can choose to go to Mediclinic, or I can go to Life Care, or I can go wherever. There is 2 beds available for me. There is no shortage of beds. But if I decide to go to the public sector, I only have access to 1 bed. And if that bed is occupied, then I might not have help. The second thing is that a general practitioner in the public sector was serving between 7 and 17 times more patients than in the private sector. And there was a 23-fold difference in the number of specialist doctors per beneficiary between the public and the private sector. So if I'm in the public, if I'm in the private sector, I have access to 23 specialists. Whereas if I go to the public sector, I only have access to 1. This is by 2007. So the disparities between public-private were growing. So under Motsoaledi's leadership, there was a flurry of policy development. So now he's rushing to, you know what? Let's do this thing. Let's do this NHI thing. So policy after policy, even during that time, the Green Paper in 2011 was released. So the Green Paper is like, this is where they're going to introduce the law to the public that we as a government are planning to introduce universal health care. This is how we are going to do it. We are proposing that we are going to increase the taxes by 3%. And we're going maybe to increase VAT. Maybe we're going to increase employee payroll, or we're going to increase some kind of fees, because we are going to, the NHI needs to be funding. Whenever you talk about the NHI, everybody's like, where is the money going to come from? This is where the money comes from the taxes. So now they're going, the government is going to introduce the Green Paper to the public for scrutiny and for feedback. So the Green Paper was committed to a program of PHC re-engineering. So in the Green Paper, they're going to talk about how they are going to fund the NHI. They're going to talk about what the NHI is going to do. They're going to talk about how they are planning to run the program. And one of the things that we're going to prioritize was PHC re-engineering, primary healthcare re-engineering. Remember, we spoke about this methodology of delivering healthcare. Governments have 2 options, either primary preventative or hospital curative. We've already seen that hospital curative is more expensive and primary preventative is more sensible and cheaper to run. So in this Green Paper, they're going to even introduce the subject of building more clinics, pumping more money into the communities, the local communities, in the villages, in the townships, as many clinics, train more nurses in primary healthcare and send them out into these units, as opposed to building more hospitals and training more specialists. If you want to just estimate differences, just go and Google the cost of training a primary healthcare nurse versus training a specialist, and just compare the difference in costs. It's far cheaper to train a PHC nurse than to train a specialist. And that PHC nurse is going to go into on the ground, on the grassroots level, and provide screening and preventative health care, health promotion, health education, checking blood pressures, checking BPs, doing pap smears to prevent cervical cancer, checking prostate cancer, doing HIV screening, providing family planning, all those simple services that prevent disease, as opposed to training a specialist who's going to sit there in some big tertiary hospital, demanding a huge salary to do operations on people who have developed complications from disease, which is far more expensive endeavor to run for a government. So in this green paper that is going to be introducing NHI to the public, they're going to even talk about how they're going to re-engineer PHC. And the focus is going to be on primary preventive care. Then in 2012, the NHI piloting project started. Now, the NHI is about testing things out. They established 10 NHI pilot sites to test the program out. In testing, they want to pick up where are the problems, where are the technical complexities, how can we fix this problem before signing the thing into law. So 10 pilot projects were initiated. I was privileged to work on one of these projects, but I think the pilot project was not properly organized and run. So, but it did, from it, they were able to pick up some problems. They picked up some challenges. Firstly, the NHI was going to be run by the central government. The national government takes the responsibility, and then the provincial governments are just implementing. Now, there was a conflict between national and provincial governments. Provincial governments were refusing to help the national government in run these NHI pilot projects. I remember in the province here that I'm working at, Limpopo, the province eventually completely refused to run that pilot project, and it was terminated because the provincial government feels like their powers are being reduced by the national government. It's all power struggles, Secondly, very few doctors were willing to work on the pilot projects, which were set up mostly in rural areas. And then in 2014, President Zuma launched the Operation Pakisa, which means hurry up. So like the PHC re-engineering, Operation Pagisa was considered an important step towards improving the public sector in preparation for the NHI. So as I was saying before, Zuma was very much for the NHI and was doing everything in his power. He puts Musoledi in leadership and Musoledi is passionate about the NHI, and now he has this project, Pagisa, hurry up, let's do this thing. And remember, Zuma is pro-poor. So then in 2015, a draft white paper. Now the draft white paper is what follows the green paper. The white paper is now the government saying, okay, we've had your feedback, we've considered it, we've run a pilot project. We think that the NHI is something that we can do. Now they release a white paper. The white paper is a communication about the government's intention to say we are now going to do this thing. So, however, in 2015, when the white paper is passed and the government has made a final commitment, they're going to be faced with huge challenges. Now, so much corruption, so many scandals in government that are going to, hold back this plan. So if we compare again Mbeki and Zuma, Mbeki was neoliberal, Zuma was pro-poor. They belong to the same party. So Mbeki is distracted by the HIV pandemic. Zuma, HIV pandemic is not an issue. He has established the Operation Pakisa. He's trying to rush the program forward. But we're going to see that there's deep failures. One of the corruptions going back to 1999, I don't know if people remember the arms deal of 1999. Remember the arms deal when Mbeki received bribes? Okay, there was this strategic defense package. It was a plan by the government to modernize South Africa's defense capacities. by contracting tens of billions of rands to improve their arms, you know. So apparently Mbeki was bribed, received a lot of bribes when these contracts were being allocated to people. Mbeki and Zuma, remember they were together. Mbeki was president, Zuma was vice president, and together they received bribes to the tune of tens of billions of rands when they were issuing these contracts or tenders, whatever you can call it. So that scandal kept the government busy from 1999 into the mid 2000s. Then after that scandal was over, in 2005, Zuma was involved in another scandal with Shabir Sheikh, who was he was convicted of having paid bribes to Zuma to do his thing. So again, Zuma found himself charged with criminal offenses, and he was taken to, you know, the National Prosecuting Agency tried to get him to account for his crimes. But in 2009, when he was elected into the presidencies, he quickly disbanded the Scorpions. And then from then onwards, you know, Scorpions, I don't know if you remember the Scorpions. The Scorpions are like the FBI of the US or CIA, whatever you want to call it, criminal investigating people. And these are the people that investigated Zuma and found his corrupt deals. And so when he became president, he disbanded the Scorpions. So now he could continue with his corruption without the Scorpions around to bother him. Then in 2008, the load shedding started due to corruption and poor operating principles at ESCOM. And all of these factors are working to undermine the government. 2012, there was a miners' strike, you remember, where 34 miners died tragically. And then in 2009, Zuma began upgrades to his private residence at Nkandla in KwaZulu-Natal. These upgrades were authorized by the Minister of Public Works, and media articles reported on the opulent and excessive expenditure to the point that the public protector actually launched an investigation in 2013, finding maladministration and recommending that Zuma must pay back the money, some of the money, not all of it. Zuma agrees to pay back 7.8 million, and to pay back that money, what does he do? He doesn't go and take it back from the project. Instead, he goes to VBS Bank to borrow the money, to get a loan to pay that money. And VBS Bank, after that, was declared went under curative. They became sort of bankrupt. And all of this was connected to the corruption, Zuma's corruption, and how the state became completely chaotic during his presidencies, to the point that even if he was trying to push forward the NHI, it was not going to be successful because of all this corruption. So Zuma finally resigned in 2018 and was succeeded by Cyril Ramaphosa. So these events, alongside other major Zuma-linked scandals, severely undermined public trust, not only in Zuma, but also in the state. So by the time Cyril Ramaphosa becomes president, he's going to try and push forward the NHI agenda. People no longer have confidence in government. So that takes us to the history of 2016 to 2019. In which Zuma's shadow continued to plague health system reform efforts and doubts about the state's capacity to regulate the private sector and deliver adequate public health care. So it's not only Zuma who was corrupt, it's just himself, he took it to the extreme. Even Mbeki was corrupt, and during those presidencies, there was a lot of corruption. You know, the arms deal, the AIDS scandals, the Nkandlas, the miners' strikes, all of these events, as they were unfolding over the past 30 years, South Africans are becoming disillusioned about government and the ability of government to rule and to distribute resources and to build the economy and to provide services. So now every time they're going to be talking about the NHI, people are going to be like, where is the money going to come from? That is not practical. How is it going to be, implemented? Even the pilot project did not really work out. So in this history of 2016 to 2019, the legacy of Zuma is going to continue to plague the government of Ramaphosa. And then, of course, all right, let me read this passage. While the NHI remained a key priority for the ANC and Motsoaledi continued to drive the process forward, the loss of public trust and the fault lines within the government caused by state capture would intersect in various ways with the NHI policy process. The NHI, they would say, is not financially suitable in South Africa. But despite this, and despite the fact that the detailed funding options for NHI promised by Treasury were not forthcoming, in June 2018, the NHI draft bill was gazetted and public comments invited by Parliament. Let's look at another scandal that further wrecked government, trust in government. In 2015, there was the Life Esidimeni tragedy. This Life Esidimeni tragedy. So what had happened is that government had entered into partnership with private sector with Life Care. Life Care is a private organization. Government is going to pay Life Care money, big monies every month, to run rehabilitation centers for patients with chronic psychiatric disorders. And they were doing a fantastic job. It's just that they were spending a lot. You understand the private sector is into things for the money. So they were providing a service for psychiatrically challenged people, providing homes, providing rehabilitation services. And the government was paying a lot of money to Life Care every month to provide these services. And some people begin to challenge this idea. They're like, you are spending so much money as government, and instead of spending it on improving health services in the government, you're actually sending it to private sector. So remember the $405 billion we spoke about. $205 billion is spent in government to take care of 83% of the population. 205, equal amount, is spent in the private sector to take care of 17% only of the population. Now, out of the $205 billion that the government has in its hand, it sends an additional portion to the private sector to take care of chronic psychiatric patients. So that the government is not doing that work itself. It's commissioning Life Care, a private organization, to do that work. I mean, I don't know, but yeah, the people began to challenge this idea because the government seems to be supporting the private sector, sorry. So then the government makes the decision to do what? They are going to make a decision to reduce costs. So they take a decision to terminate that contract with Life Care, Life Healthcare Esidimeni. And they're going to now do what? They're going to take all these patients and discharge some of them, refer some of them to NGOs, or transfer some of them to public hospitals with psychiatric wards. So during that time, anybody who felt like, I can do this work, I can take in psychiatric patients, I can provide them with care, would register with the government. And then the government, for one patient that they would spend, I don't know, they used to pay tens of thousands of rands per patient to Life Care. Now they're going to get these private NGOs run by private individuals who are going to charge you 3,000 rand So instead of spending 20,000, they're spending 3,000, right? And so they're going to take these patients, some discharge them, some transfer them to public institutions, and some send them to these NGOs where they are, instead of paying 20,000, they are paying 3,000 per patient. Now, what services can be provided with 3,000 as opposed to 20,000? Let me give an example. Life SCDMED institutions would provide centralized heating during winter. These private individuals with 3,000 could not provide centralized heating. They just make the patient sit in front of a heater if they could afford the gas and the electricity. At the end of the day, 91 patients died in those NGOs. And all 27 NGOs to which patients were transferred were operating without valid licenses. The Life Esidimeni saga therefore reinforced existing public perceptions of poor quality care in the public sector. So they are paying big bucks to the private sector, but yeah, the private sector, because they are paying it big bucks, they provide top-notch healthcare. They have all the nurses, they have all the doctors to take care of these patients. And now the government takes those patients into public NGOs that are run by their relatives or their friends who can't afford to provide all this top-notch centralized heating, good diet, doctors, nurses, 24 hours on call. Patients died. And then when they died, this became a major scandal for the government. And now these are the issues that are going to lead to people questioning the validity of the NHI. These major scandals such as this one. So in 2018, a report was released soon after the publication of the draft NHI bill, and then a final report released in 2019. And now, after all the debates from 2019 to 2024, we know what has happened. The NHI was passed into law in May. And now we are in the first phase of implementation, which is they are planning it to take 3 years. And then there will be a second phase, which will take 4 years. It's the first phase that will be 4 years. Then the second phase will be 2 years to fully implement the NHI. And we are back to a government of national unity. I'm not sure what the impact of the government of national unity is going to have on the general project, but I know that voices are even louder now against the NHI. So that brings us to the end of the history of the NHI, and I'm inviting questions or comments.
Elder,
Yes.
I just want to thank you for helping us understand this long history and actually helping us to understand South African politics, even if you're not touching on everything, but it actually it made sense for me to actually, because I think South African politics are really complicated. Because when you were talking about Zuma, that man has always been a mystery to me, because I can see that he actually cared about people, but you can also see that he's patriarchal. During his administration, you can see the good things that he did, and yeah, thank you for that. But there's this thing that I'm realizing on the side, that I remember the first time that we were talking about radical feminism. I think it was on Vespers, the first time I ever saw what's the thing that we were talking about? I'm missing the word. The thing we're talking about. Okay, there's communism, there's capitalism. That's the one I was looking for.
Oh, capitalism.
Yes, that's the one I was looking for. I think I really underestimated just how central it is to actually keeping patriarchy going. I think it's everything. I think for as long as capitalism is the order of the day, we will always have patriarchy, because I think it's one of the tools. It's I just it's making so much sense to me, just how dangerous capitalism is, because we will always compromise for as long as there's capitalism, no matter who, where, Democrats or ANC, we will always compromise as long as capitalism is still around. And we say we have to break the structure. How are you going to break capitalism? Like, oh my gosh, like seriously. Yeah, it's been eye-opening for me, and thank you for the study.
Thank you for that comment. Yeah, for sure. Capitalism goes hand in hand with oppression and discrimination, because for one to exploit the system to their benefit and produce, because capitalism refers to an economic system in which a society's means of production are held by private individuals or organizations, not the government, and where products, prices, and the distribution of goods are determined mainly by competition in a free market. So in that free market, it is to say, government stay out, don't control our activities. We want to make money. So for example, in the private sector in South Africa is like, we want to make money. We want to be free to do what we want. And, the prices are determined by the market forces. And market forces, they mean supply and demand. If I'm in this Louis Richard, I'm the only gynecologist in this town, it means all patients come to me who need gynecological attention. I can literally charge any amount I want. And I can just get rich because there is no competition, right? So this is the mindset. It's about greed. It's about selfishness. And it must exploit a class of people. There is no capitalism without exploitation. That is why even in a perfect world, like perfect countries like Scandinavian countries, which are considered to be, I think not even, that's not a good example. USA is a perfect capitalist country. That country was built on the back of slavery. I think we need to just acknowledge that part. It doesn't matter how much Blacks have been oppressed and prevented from developing in the education sector and in terms of being scientists and in the IT industry. The fact is that America's development and its progress is because at some point they were able to make a lot of money using free labor, using free slave labor. South African history is the same. Mine workers, who cares if they drown, they die there in the shafts. There was always such a huge number of them. They could just be replaced overnight, and they paid them little money. And the fact that they had access to these Black workers that they could send down into the shafts to dig up that gold, and then they get that gold out of that man's hands, the one who has dug it, and ship it off to the UK. This is what has made the British Empire powerful. British Empire is not powerful because they have resources. It's because they exploit other people. So capitalism is about discrimination. You have to discriminate, and then you have to oppress. And that system runs hand in hand with patriarchy. And Zuma, when we talk about Zuma, even though he's pro-poor, he's authoritarian, and he's patriarchal, and he's militant. And this is what makes his contribution a little bit dodgy. Mbeki also had his problems. He was a neoliberal, very capitalist in his mindset. And therefore, he couldn't do much to push the agenda of the NHI. Whereas Zuma was willing to push the NHI forward, but in terms of actual, the corruption, if he's going to improve his house, his private household and upgrade it, he's siphoning all those resources from the very plan he's trying to run forward. That's the patriarchal mindset. It's very much selfish. And that's why, people that are patriarchal, or households that are patriarchal, you will see that whoever this man is that is the head of the home, he has the final say in things. Without consultation, he does what he wants. And he thinks he's doing what is good for his family, but he's actually bringing them down. And that's what Zuma is like. Zuma is like that daddy who makes all these decisions. And he doesn't really sit down to think the impact of the decision. Because on the one hand, he's trying to implement NHI. On the other hand, he's siphoning money to renovate his house. Are there any other comments or questions?
Hello?
Yes, Milton.
Yeah, just to add on what Nokanya was saying, that is why we are going to see that the nation that heads the order of the end of the world prophecy, which is United States, those are some of the finer details which proves that when you look at them as the head of the states at the end of the world with the capitalist system, it has a lot of impact worldwide. There are countries which have different models of governance, but they cannot influence the world in a different direction. And even some of those principles that are right are going to be challenged, and it will be difficult for them to compete with those models. So the most powerful and influential country has made that influence difficult to come up with an alternative. So we have to live through the consequences of that. And whether it's Democrats or Republicans, where we are now, they cannot change that system. I think the idea of capitalism has gone unchecked for so long, and it has caused so much damage, wars, and everything to defend. And I don't think it's gonna be overturned, because it's gonna break this world into the chaos that is the end of the world has been prophesied to be. It's what is driving all the suffering worldwide. Even when you look at Americans, they've got one class of people who have money that can take care of everyone without any stress, but they choose to just keep their money and their names as gods and allow the society to suffer. Where is their conscience in doing that? On the other hand, you have got those who have social mindset, like Putin. They also put all the money in their baskets, in as much as they say they will defend the poor. The same thing with the Chinese models. So I think at the heart of all this, it's patriarchy which has ruined the world, and there is no way we can expect a world that is going to be fixed out of patriarchy. Feminism is just highlighting the problem, and those who are willing to change can be stemmed in a different way from this. But actually, it's a sad reality.
Thank you, Milton, for that comment. Yeah, the selfishness, yeah, unless the selfishness can be addressed, I think, yeah, it's true what you're saying, and it's what Erica and Tato were saying this morning. I have shared the document of the social political history of South Africa's NHI for those who are interested. Is there any other contributions? or comments? Anyone wants to say something?
And I add something. I just remember something. There's a passage in the Bible, maybe you can help me, that says how the people will know that we are God's people is because of the love we have for one another. And I think everything you can put through the filter of love. If you really love someone, you will give them the best medication and the best stuff you ever possibly can. So it tells me those who are opposed against, I always, NHI, or what's it again?
NHI.
They do not have love. Any racist has no love. So that means they are not God's people. And I think that is where we can discern what is the right stream of information, what side is the right way to go. And that's why I always chosen sort of Ramaphosa, if I can use just his name directly, because when he talked about there's a war against women in the time of the COVID, and he said there's a war, and that is one of the reasons why he banned alcohol. I says, this man loves women. So I think we should more always through the filter of love, because that is our in message. It's really all about love for God and love for the people. And if we throw love out, we have nothing. Then we like 1 Corinthians 13. So yeah, excuse me, that's all I wanted to say.
Thank you, Erica, and love your avatar. You teach me how to do this. But yeah, yeah, it's very true. It's all about love, and it's all about doing to the next person as you would have them do unto you. At the end of the day, that's what it boils down to. It's the choices that people have to make on a day-to-day basis. In South Africa, it's all about, do I work in the public sector? Do I work in the private sector? What do I do? You know, when I look at where I work in a very rural community in Limpopo. I mean, Limpopo is already one of the poorest provinces in the country. But even within the provinces, there are rich areas, there are poor areas, there are cities, there are villages. I could very much work in Polokwane, but and I didn't end up working where I was by choice. It all just happened by accident. But, being there, and now in the context of the message that we have now, when I look at it, sometimes I get so depressed because the work is overwhelming. There's so many people. Our hospital is servicing 32 villages plus, in fact. All those people come through us, and it's so busy. With some of the outpatients get so hectic, so full of people, and sometimes it gets so overwhelming and depressing, and you're thinking, what am I doing in this area? But then sometimes, and then I think to myself, if we are not here, then who is going to help these people? What's going to happen when they are sick? Because I feel like a cataract in someone in Mossel Bay shouldn't be different from someone in one of those villages. I think that they should both receive the same care at the same time, the same quality. But the world is going to end with some people having access to better things than others. And that's the reality of life. And I think it's really unfair and is driven by selfishness. So in our lives, when we look at our lives, I mean, I don't know what everyone's situation is, or where they work or where they don't work. But I think it's important for us to always think of the next person, because they are also created in the image of God. And I think this, we know this is going to be the point at which this world is going to end. It's the point of whose life is more expensive than the life of the next person. This is going to be our undoing as humanity. We faced a lot of challenges as human beings. We face, disasters in nature. We face pandemics. We face a lot of challenges, but where we suffer the most, it's because of the selfishness of others. It's about economies. It's economic. And when we're talking about economies, you're talking about money. And this is where we, as human beings, we completely fail, because we don't take into consideration the next person. And we live for ourselves. And that's why we have a system, like we have a party, ANC, that took up the mantle to fight for universal health coverage. But now when it's given an opportunity in 1994, what has the ANC done? It has become just as selfish as the previous governments. It has a plan, it has an ethos, it has a rhetoric, but it hasn't lived up to it. It's still repeatedly getting overcome by the issues of money. There just doesn't seem to be enough of it, or there just seems to be people that are not ready to share it. And so others suffer. Anyone else?
Elder T.
Yes, sir.
Yeah, it is a powerful study, and thank you so much for sharing. There was so much light shed. I got to understand that the NC compromised a lot, and it's fascinating when you related the history and how the president, one after the other, failed to implement what they should have. When you speak about Thabo Mbeki in his time, and when the pandemic of HIV and AIDS came about, and people said, "No, let's eat beetroot, let's get good nutrition, and it's nothing serious. It's not a thing that would kill us, you know." And then Zuma did this. It's I was worried when I see the same mindset which people had when COVID-19 came about, where they would believe that they're just trying to get rid away of us as black people, and they want to eliminate us. Let's use ginger and garlic. Let's use herbs. So it was, I was mind blown by all of that. And you see that by the time of Ramaphosa, if the NHI was instituted long ago, a lot of things would be better. A lot of people died in the public hospitals because what was supposed to be implemented long time ago, of which there was a good plan in the beginning, was not implemented. So as we are seeing, people died because of the selfishness, and the inequality just went on and affected a lot of people. So it's a powerful start, as I see it. Thank you so much, Elsa.
You're welcome. We thank God for that, and for revealing all this history to us, and once again showing us how we need to think, how we really need to think about others, and how you never realize the impact of healthcare until the day that you yourself get sick. And And then you're thinking, I don't want to go to that hospital, but I don't have money to go to a private doctor. It's all about the politics, the mindsets, the philosophy, the policies that are behind the policies, the politics behind the policies that are in place. And right now we are in a system of inequalities because either the private care is not accessible financially and you're stuck with the government, and then you go to the government and you're stuck because the services are poor. Yeah, so may God help us to always make the right decisions and have right thinking about things that we come across, on a day-to-day basis.
Hello?
Yes.
Yeah, it's
Go ahead,
interesting.
Milton.
Even now, when you look at the American election currently, looking at the history of compromise on both parties, it has boiled down to a point where you have two characters which are now representing leadership in the basic, simplest form. Trump has made it clear that he is going to protect the rich with all means, and disrespecting women is publicly done, and people know they don't have like confusion about that. And then now you have Kamala Harris. Yes, they have good policies which they can talk about, but they are now taking an avenue of just contrasting the bad behavior and try to project the idea of love and being empathetic. So it's now coming down to that simplest form of using equality to contrast and make a point. And I think you can see now that those who are making a choice to stand with the Republicans, they just revealed their mindset that we don't care. Even if it's women who are voting, they know that this man is disrespectful. He doesn't care about us. It just shows the mindset. It's very clear. And I think that election is giving us a clue to where we are now, that they cannot use any other thing, policies or anything they've messed up on in the past. And it has boiled down to those two basic principles. And it's really showing us that that's where the test is, in as much as there are other things that we can look at. I'm just interested with what even Erica mentioned, and you look at what's happening in America. They are using that principle. You either choose disrespectful or person or someone who considers empathy and being responsible in their actions.
When I went to KZN earlier this year, and with Nomboso went to visit some members, and they were telling us that they are pro-Zuma. And we highlighted the issue of patriarchy. We're like, yeah, you can support Zuma, he's pro-poor, but what are you going to do with the patriarchy? And Zuma is well beloved by many people, even in Mpumalanga and Limpopo, people that he gave jobs. He created jobs, he gave people posts, he did all kinds of things for the poor. But he has a lot of patriarchy in his mind, and he's very authoritarian. And he demonstrated that he wouldn't appropriately apportion public funds. And so it just shows that even though he belonged at that time to the ANC, which had a freedom charter to cover for health, he was held back by the patriarchy. And patriarchy is a force that cannot be separated from capitalism. I think that's what we are concluding today. And I think, to me, when you, Milton, you're talking about Trump, I keep thinking of Zuma. It's like they are they are the same person in some regards. I know that Trump is not pro-poor. Zuma is pro-poor. In some regards, they are not the same, but at the end of the day, they seem to fit into the same category. So we shouldn't be confused. I think going forward, we should have more understanding of South African politics, you know. And I encourage everyone to read that document.
Oh, but thank you very much, Elida, for the message. We are so blessed to have this knowledge, because the world there, they don't know. Even God's people, they don't know what we are having, this knowledge of inequality in the world today. It is true. When you spoke about life settlement, I was working in life settlement. And when I retired, they were already, I mean, the government of Gauteng were taking away the patients from life settlement. And I wanted also to apply to get to be an NGO, one of my friends, but I didn't encourage it very much. But later on, I helped someone to start a home. But life is very, people are always in inequality. People think they work for other people. They don't work for the lower people. So as the elder said, that these patients were taken in life care or life settlement, they were being entering on others 10,000, others 12, others 20,000, the last one, as the years we are going. Now, when they go to the NGO, local people, any who, even others were not qualified, you just try to apply and they give you the patients, as the elder said, they were, they were given the money very little compared. If one patient is given 20,000 at those years 17, now is getting 3,000, you cannot run a home. Unfairness of the world. You cannot afford central heating. You cannot afford going into the what? They made it so attractive that you will get treatment this way, but it was not like the one who were accompanying the life settlement. They were being given money. There is a lot of things. That's why many of them were closed. They failed. And so life which we are learning today is to see inequality in the world. Because when you want a proper treatment, you have to pay a lot of money. And ordinary person, the lower class, cannot afford to be operated on an eye. Mine was 28,000. Which is too much for it. Was until today. Now you have to go to ordinary one, and there, because you are so many, there is no accountability to you. They do you anything. So that is where the life of this world, where we are, it is very unfair for many others. But when we know equality, we need to thank God for the knowledge, to know that we are in the life, the world where there is inequality, or whether the rich, they have to oppress others. In order to reach up, there is no, it is only to be faithful to the Lord, for me, I think, and we know the proper equality will come. Christ comes. We are looking forward. But in this world, let us keep on loving each other. As it has been mentioned by many in this, is to show love. What you ever doing, you must be practicing equality at your level where we are. If you have somebody under you, if you have a wife, make it up to you. You are equal. So it is not something only to study, but also to practice it practically. And the patriarchal system is embedded in a human being. Wherever you go, in the business, where we are poor, it is still there. In the families, is really a struggle. Men cannot accept equality with the women. It is not easy. It is only those God who has touched their heart, it will know, because Satan is working hard to separate the two. And that is why we study these things, so that we can practice equality where to our level. But the world is there for all, whether any politics, any what, business, anything in the home is really problem. So let us practice where it is possible, and pray the Lord to change our heart.
Okay, thank you for that contribution. Thank you so much. And thank you everyone for your contributions. Thank you for sitting out all this time to listen to the study. I'm just glad that we have completed it. I didn't want to have to continue another time with this. I've shared the documents, so you are all free to go and study them for yourselves and get a more comprehensive understanding of this history. But I will try to now summarize and close. We've been looking at the NHI because it's an issue that is being agitated in the media and in South Africa in general. Let's remember that 8% of the GDP is spent on health, and that's split half-half between the public and the private. But the disparity between the populations are quite immense. And we've gone through the history from 1924, when a government of national unity was created, and started debating on whose responsibility it is to take care of people who are not able to take care of themselves. Is it the responsibility of the government, or is it the responsibility of the individual? And we've looked at that tension that exists between a right-wing mindset. Right-wing mindset says the person that is poor and cannot take care of themselves is their responsibility, it's their fault. Therefore, that burden should not be put on that person that has money and can take care of themselves and has done something for themselves. And that mindset has been in conflict with the left wing, which says the government is responsible for all citizens. And that discussion has been on and off all through the history of South Africa, even through the creation of the apartheid government in 1948, and how they favored the white populations and taxed Black people to take care of white populations, and completely excluded Blacks and Indians out of that equation. And how in 1948, the ANC then takes up the mantle of fighting for equality with respect to healthcare provision. But how they come to 1994 and compromise because they feel because of pressure from the external world and from an economy that was failing and from a corrupt government that they were inheriting. But we proceed to see how they become corrupt themselves and misuse government funds, how they are distracted by the HIV pandemic in 2000, in the early 1900s and into the 2000s, but how they try to get back on track through during the Zuma presidency, but how Zuma himself then actually undermines the whole project through his own corruption. And so we come to now 2024 when the NHI is passed into law, and thank God that that has happened, but we're really not sure how it will play out and if in fact it will be established to serve people as intended. At the end of the day, let's remember to treat others as we would like them to treat us. Let's remember that what we wish upon others is really what we're wishing upon ourselves. And let's remember that we should never do something to others that one would regard as an injury to oneself. And align ourselves appropriately with the message and how God wants us to love others. As Erica was saying, love is really the governing principle. But I think before the message of equality, the way we viewed love was completely distorted. And it's only now that the message of the midnight cry message has come that we know how love looks like here at the end of the world. I know we've been primarily addressing politics and race issues, but actually, ultimately, is patriarchy. Patriarchy is what we are dealing with, and I'm glad that it has been identified in this study as such. We are dealing with patriarchy. Patriarchy is the image of the beast. We are in the history of the Sunday law as it's unfolding. We are heading towards the American elections, and we know that whether Trump wins or not, even if Kamala Harris wins, she will be facing a lot of backlash. And is already facing it because already they are debating whether her vice president should be a white male or a fellow woman. This is now taking the center stage of this debate. Like, why should it even matter that it can be another woman? And I think that as we've traced all this history, or this South African history, and any other history for that matter, I think sexism and patriarchy have contributed so much to discrimination and racism. And maybe the answer is to just forget to see people according to gender and race. And that's what God wants from us anyway. So, yeah, let's close in prayer. Dear God, we thank you for enlightening us, and we thank you that we are in critical times and so much is happening around us, and we are wanting and seeking to understand it. Even though we are excited about the end of the world, we still have to go through some difficult times as the Sunday law is upon us. I pray for every person that is here and even those that are not able to join. Lord, may we all be found faithful. May we continue to hold on to the truth because our salvation is closer than it has ever been before. And I pray that none of us will be distracted or derailed so that we all will be saved in your kingdom. Help us to do away with all our prejudices, with all our anxieties and our worries and whatever has transpired in our past to make us who we are. Help us to change our minds so that we'll be more like Christ. And because it's only as we have this mind change that we can be fitted for heaven. We ask that you continue to be with us and the rest of the Sabbath. In Christ's name we pray. Amen. Amen.